Alright, my name is Lillian Erickson, and this is my video for health assessment for professional skills. So I have an order here for my patient, Pat Smith, and it is for Dilaudid 0.5 to 1.5 milligrams every 3 hours PRN. So I know that he first received 0.5 milligrams of Dilaudid at 7:30, and it is now 8:30. So he's received 0.5 of the maximum 1.5 milligrams. He's stating his pain is at a 9 right now. So we're going to give him the other 1 milligram to complete the 1.5 milligram order. I also know that he has a central line with one unused port, so that means I'm going to need to use 10 milliliter syringes when I'm giving this, so that I maintain pressure, or there's not too much pressure on the central line. So I'm going to take my order and I'm going to compare it with my MAR. I'm going to make sure that I have the right patient, the right drug, the right dose, the right route, the right time. And everything looks to be correct. So I'm going to gather all my equipment and I'm going to use my flushes. So I have, first I'm going to drop my heparin. Because his port is heparinized, so we know we need to put about 100 to 500 units of heparin in after we give the med. So I'm going to draw up my heparin, and I've got a 100 units per milliliter vial. So I'm going to take a 3 milliliter syringe with an attached needle. So that's in the right. Okay, so I'm going to inject 3 milliliters of air and withdraw 3 milliliters. That's the max I can get in this syringe of heparin. So then I'm going to take a empty 10 milliliter syringe and I'm going to put my heparin, my 3 milliliters, into the empty syringe. So I can prime it. So, and I would put a cap on. We don't have a cap, but this is my heparin. I also would have alcohol swabbed off the vial when I did that. Alright, so for my Dilaudid, I have 1 milligram per 1 milliliter, and I need 1 milligram, so I'm going to drop 1 milliliter. So for Dilaudid, I know that it does not have to be diluted to give, but I can dilute it in 5 milliliters of normal saline. I've found that, the dilution, in my drug handbook. I've also looked up compatibility, and it is compatible with normal saline. The rate, I've also looked up the rate. It can be given over 2 to 3 minutes, IV bolus. And also the antidote for Dilaudid is Narcan, so I want to make sure I have that on hand if I need to use it. So I have my Dilaudid. I need to drop 1 milliliter, so I go to 1 milliliter and I inject 1 milliliter of air and withdraw 1 milliliter. Just see it with the drink. Alright, so I can recap that. And also I would have put on gloves when I started withdrawing my medications, but we'll just say I had them on. I'm still at my nurse's station. Alright, so I can take off my needle, maybe. Oh, first, before I take off my needle, I'm going to take a syringe, and I've pushed out 5 milliliters. So I'm going to withdraw another milliliter so I have room for this. And I'm going to put this in. Alright. And so I can prime it as well. So here's my Dilaudid, my heparin, and I have my 2 flushes. anymore. Alright, so I can go into my patient's room now. Alright, so I'm going to come into my patient's room and introduce myself. I'm going to draw the curtain so that he has privacy. And I'm going to tell him what we're going to do. Hello, Mr. Smith. I'm your nurse today. And I need to check your armband. And I'll have him give me his name and his birthday. So I'm checking his armband. Pat Smith, December 16th. Alright, and then I can be assessing his central line and make sure everything looks good, the dressing is intact. And then I'm also going to check his allergies, check his armbands if he has any allergies. And I recall from his information, he does have an allergy to morphine and to eggs. But that's not applicable in this situation. So I'm going to look at the site, and everything looks good. He has fluids running into 2 of his lines, so we're going to give it into the distal port, because that is the port that we give medications into, and that is the only unused port that we have. So I'm going to put on my gloves. I'm going to wash my hands first and then I'll put on my gloves. I can also check the date on my central line, make sure that it has the right date on it. So first what I'm going to do is I'm going to take my flush of normal saline. Okay, so I'm going to alcohol swab this off, and then I'm going to use either Chloroprep or Betadine as well. Okay, so, and then this is clamped. The line is clamped, so as soon as I can get this on, I can unclamp it. And I'm going to draw back, make sure I get blood return. I'm going to push 5 to 10 milliliters of normal saline in, and then I'm going to unclamp. I'm going to clamp again before I take it off again. Great. Alright, so now I have my Dilaudid. This is diluted in 5 milliliters of normal saline, and since I dropped this, I would alcohol swab it off and Chloroprep it off again. Ideally, I wouldn't drop it. So, put that on, unclamp it, push it through, clamp it up again, take it off. Alright, and then I'm going to take my other syringe, flush normal saline, flush it through, or unclamp it, flush it through, clamp it up. Alright, and lastly, I'm going to use my heparin. I'm going to put into a 10 cc syringe. I'm going to put that on, flush it through. Oh, and I forgot to mention that when I do the Dilaudid, I also know that I need to give it over 2 to 3 minutes, so I'll be looking at a clock and doing that over 2 to 3 minutes. Alright, so I'm going to push my heparin in, clamp it back up, take it off. I'm going to assess my site, make sure everything looks alright. And I've completed his order for 1.5 milligrams of Dilaudid every 3 hours. And that would complete this skill.